Hello, ACR Convergence 2021. I'm Dr. Rachel Tate, and today I wanted to share with you RheumNow's Team PsA Best of for Saturday, November 6, 2021. So the first abstract I'm going to share with you is abstract number 0488 in Emerging Therapies, which looked at Brevisin, which, as you know, is a TYK2/JAK1 inhibitor that has already had good results in plaque psoriasis and alopecia areata. And this particular abstract looked at its efficacy and safety in terms of psoriatic arthritis. So this was a phase 2b placebo-controlled study. There were 218 patients that were enrolled into the study, and they were placed either into placebo or Brevisin 10 milligrams, Brevisin 30 milligrams, or Brevisin 60 milligrams. So at week 16, more patients in the Brevisin 30 milligrams and 60 milligram arms achieved an ACR 20 versus placebo, and those responses were maintained out to week 52. So more AEs were noted in the treatment arms, of course, versus placebo, but there were no additional safety signals. In fact, there were no MACE or VTE signals in this study period. So this does show that Brevisin is not only good for the skin, it's good for the joints and the entheses as well. And overall, the safety profile is what we've come to expect from JAK inhibitors. Our second best of PsA is plenary abstract number 0453. So this was Rizazumab, which, as you know, is a humanized immunoglobulin G1 monoclonal antibody that inhibits IL-23 by binding to its P19 subunit. So keepsake 1 and 2, which you're familiar with and we've reported on before, those trials looked at Rizazumab versus placebo in PsA patients up to week 24. The primary endpoint for both of these studies was an ACR 20 at week 24, and 1,300 patients completed that 24-week assessment and achieved a higher ACR 20 versus the placebo group. No additional safety signals either in this particular plenary session. And then our third of best of abstract is number 0064. So this was a Canadian study by the esteemed Dr. Ocampo et al., which looked at over 3,300 patients who had AS and PsA, or PsA. In this particular case, the patients either had AS or PsA to determine incidence of uveitis. So we found that 30% of AS patients versus only about 8% of PsA patients had uveitis in the study. And further, flare rates for uveitis were higher in the AS group, about 12% versus 1% in the PsA group. New onset uveitis was also more commonly seen in that AS subset. So the factors that they found increased the risk of uveitis included an elevated ESR and an elevated CRP in the AS group versus being male or having an HLA-B27 in that PsA group. So from Team PsA, these were our top 3 best of abstracts from ACR Convergence 2021 for Saturday, November 6, 2021. Continue to get more ACR updates from us at rheumnow.com.